A lumbar disc herniation basically means that the disc, our body's natural shock absorber in the lower spine, herniates, meaning it leaves its normal contained space, but when it does that, it has to go somewhere. And when it goes somewhere, it often can compress, which means tightening, can pinch a nerve, and that can result in pain in the lower back, pain in the buttock, the infamous sciatica, pain traveling down the back of your legs.
As a neurosurgeon, our first job is to say whether someone needs surgery. There are these things called red flags in neurosurgery that we absolutely have to rule out to make sure someone does not need emergency surgery. Those are usually leg weakness, impending nerve damage, saddle anesthesia, numbness around the anal area, or loss of bowel bladder function. When those things happen, even a simple lumbar disc herniation becomes a surgical emergency. But in a very large majority of our patients, that is not the case, and a lumbar disc herniation simply causes pinching of a single nerve root, which can be diagnosed with an MRI and a physical exam to basically correlate to the patient's complaints. In those cases, the treatment option is usually just what we call a simple one-level microdiscectomy. Very small incision, often less than an inch or half an inch, done through a minimalistic approach, either through a tubular discectomy or through what we call a mini open, where we have minimal trauma to the muscles or the bone, and the disc is teased away from the nerve, and the patient feels great and goes home on the same day. For chronic disc herniations, or when there is a disc bulge that's been there for years causing chronic pain, options are a little different, and that's where lumbar artificial disc replacement can also be one of the options that we entertain.